In May, the Trump administration and Secretary Robert F. Kennedy Jr. released the first Make America Healthy Again report, Make Our Children Healthy Again, on chronic diseases in children. A new draft report on strategies to fight chronic illness in kids was leaked but not officially released yet. Welcome to Care Talk Live, where we talk about how healthcare works or doesn't work in America and get you answers. I'm Laura Packard, cancer survivor and healthcare advocate, here to help you. Please text or call in your health insurance and healthcare questions at 202-838-6837, and our experts will answer them in future episodes. Be sure to subscribe to my channel or podcast wherever you get your podcasts to get next week's Care Talk show. In today's episode, healthcare expert Miranda Yaver talks about the new draft MAHA report and what it would take to truly make America healthy. So welcome, Miranda Yaver, Assistant Professor of Health Policy and Management at the University of Pittsburgh and co-author of the new Defend Public Health report called Improving the Health of Americans Together. Welcome, Miranda.
Thanks so much for having me.
So let's start with what you have seen and heard so far about the MAHA report that is not out yet. What are the things it focuses on and what is being left behind?
One of the challenges with the MAHA movement has really been that, in a sense, some of the starting points make a lot of sense. We want to improve nutrition. We want to improve chronic disease management. But then sort of across the board, what we've generally seen is a real lack of appreciation for the broad systemic factors that ultimately drive a lot of the public health problems that we observe. And what we end up seeing in both the MAHA report that was released in May, as well as the apparent outline that was circulated a week or so ago, was a continued inattention to these root causes of illness and barriers to healthy eating and other factors, as well as a persistent vaccine skepticism, which in the setting of, given all the measles outbreaks that we've seen across the country, we know is very dangerous.
So, one of the things that I've heard is that you can't look at chronic diseases and illnesses amongst children without looking at the number one cause of deaths of children, which is gun violence. So, let's talk a little bit more about what's not in the report if you want to be serious about making children healthy again.
Right. So yeah, it's hard to really think about children's health without addressing gun control and the need for it in this country. I was part of a team that investigated pediatric firearm mortality in the U.S., especially following the relaxation of gun laws. And this is something that we can address if we choose to. There are a number of other issues that are really critical, namely Medicaid. In the One Big Beautiful Bill Act, we saw historic cuts to Medicaid. There are a lot of children that are dependent on this as a source of their health insurance. 1 in 5 Americans is on Medicaid right now. And when we don't give lower income children the tools to be able to get to the doctor, it's hard for us to make successful interventions to address issues of chronic disease and beyond.
And would you say that the report is covering some things like healthier food supply, but also there is a persistent reluctance to go after any companies that might be making food less safe in America, that unfortunately corporate lobbyists, I guess, defanged some of this report and possible recommendations that should have been in there.
Yeah, I mean, one of the things that we know is, so we know that the MAHA movement is very concerned about what children eat. sort of the and issues of childhood obesity. And of course, these are public health problems. But it's also hard to celebrate getting a certain dye out of foods when we also know that we're making it harder for people to afford healthy foods. And so, whether thinking through the lens of corporate influence or whether thinking about the decimation of the American safety net that we saw in recent months through cuts to SNAP, we're going to see that even if there are sincere preferences to promote healthier eating, the actions aren't really lining up with that mission. And in fact, programs that were aiming to improve the nutrition of children's school lunches, for example, actually saw funding cuts. And so if we want to really make inroads on these important problems, we need to be able to invest in the programs that we know work.
Mhm. And the focus on food desserts, like changing the colors of dye in Skittles, is missing the larger problem of food deserts, of
Yeah.
large places in America where you can't get healthy food for your family, including your children.
Yeah, and so exactly. And so a lot of Americans live in food deserts, which for those who don't know, essentially means that rather than having a lot of access to produce and other whole foods, what you're essentially relying on is like quick marts, convenience stores, which tend to overwhelmingly have processed foods. And you might know that you're supposed to eat other things, but if that's what's available, you got to go with it. And so, and what I really jumped out of me with the MAHA reporting that we've seen has really been that we need to focus on the recommendations for a healthy diet when the problems aren't really that we think that something is healthy when it isn't. It's that we don't, it isn't accessible or it isn't meaningfully accessible, whether due to geography or due to cost.
Mhm. And focusing in on what form of fat that you fry your French fries in is missing the larger issues of whether you can have access to healthy fruits and vegetables in the first place, or whether you can afford those fruits and vegetables, let alone whether your community has them available to buy. So it feels like this coming report is focusing in on the small things and missing the bigger picture.
Absolutely. And for those of you, and I know that I was actually surprised to learn this when I was digging into this research and policy and teaching. But SNAP benefits right now were about $6 a day per person. And we just saw about a 25% reduction. And so, just to give you a sense of the extent, even though this has been a program that has been critical for people's food security, but it's not as generous as some people might think, which is just to say that there are a lot of people who are still pinching pennies, and we're seeing grocery prices increase right now. And that's only going to make this food insecurity worse, and it's going to leave ringing hollow a lot of these words about wanting healthier eating when we're undercutting a lot of the programs for that end.
Exactly. And how many people can survive on $6 a day with healthy fruits and vegetables? I just bought a bunch of celery this weekend that was over $3 for a small bunch of celery. So that's half the food's budget, half the daily budget gone for just celery, which is, of
Exactly.
course, why if you're on a budget, you're looking at pre-processed foods, the cheapest possible foods at the supermarket, which may or may not be full of protein and vitamins and whole foods, fiber, is the things that a nutritionist would guide you towards. There's money problem here, that the report, unfortunately, and this administration, unfortunately, is not addressing.
Absolutely. And one of the challenges is that a lot of when we look at who is in our government, it's not generally people who have had to think about, can I afford my prescription drugs and do a full grocery run? But these are challenges that everyday Americans face all the time. And ultimately, that can cut against better nutrition. But when the people who are setting policy don't have that lived experience, and aren't talking to people who do, that can create these problematic disconnects.
hmm When a report is written by and for billionaires, it doesn't cover people that buy their own groceries. So let's talk about the report that Defend Public Health put together, and how would what would we do in America if we actually wanted to make our children healthier?
So what we did in defending public health is we created an evidence-based response to a lot of the concerns that face American public health, and it's called the Improving the Health of Americans Together, or IHAT report. We covered several pillars, including vaccines, gun violence, sexual and reproductive health care, health insurance. I'm a health insurance expert, so I'll start with that. One of the things that we absolutely know is that people that in a country with notably expensive health care, investing in health insurance access is truly critical to be able to stay on top of chronic diseases, which the MAHA movement has expressed a lot of concern about. So it's one of those things where, even though so much of our health is determined by outside non-medical factors, from poverty to the environment, to education, still health insurance is often a necessary condition to being able to get medical treatment. We also talked about the importance of combating scientific misinformation and disinformation, especially around vaccines. We have seen measles outbreaks across the country, including with some fatalities. We don't need to live in a world where our children are vulnerable to another measles infection. But unfortunately, for so much of the country, there is this precarity of whether measles is going to crop up in their community. And so being able to have scientifically informed research and guidelines and access to vaccines is going to be critical, so that we're not fighting decades old battles against public health, against health conditions that we had previously well managed. And of course, as we started this conversation with, gun control, because we don't, we really do stand out in this country in leaving so many of our children vulnerable to gun violence in schools, or to just accidents at home. If something is not properly locked in a safe, we've seen those kinds of incidents, and they're tragic, and we can do something about that.
hmm And for people listening and watching at home, if people are wondering, where can they get good, medically sound, fact-based information for, what should you be feeding your child? What should you, how you can have a healthy home environment for your child that maybe has a chronic illness, or maybe you want to try preventing some chronic conditions. Where can people get good, fact-based evidence, good fact-based, useful information these days that is probably not TikTok?
I tend to turn to the guidance that's being issued by medical societies. So one issue that I brushed past was sexual and reproductive health care, restrictions on access to comprehensive care in this department can undercut child and infant health, maternal health, all of these things. And so American Academy, pediatricians, American College of Obstetricians and Gynecologists, and other medical associations often will provide their guidelines based on sort of clinical evidence, and I often turn to those sources. And then for news developments that are sound, I'll tell you, I can say that I am an avid reader of stat news and a lot of different public health and health policy reporters who I trust to give me evidence-based analysis of current developments.
Well, thank you very much for joining us, and I will put a link to your report when we release the podcast. So please, everybody, read the report to find out about how to make Americans healthier, the things that are left out of the MAHA reports. So thanks again for joining us.
Thanks so much for having me.
And now I'm pleased to welcome Diane Archer, the founder and president of Just Care USA and senior advisor on Medicare at Social Security Works, and Louise Norris, health insurance and healthcare reform analyst at healthinsurance.org, where we're going to answer your health insurance and healthcare questions. So let's start with Louise. Talk about some recent court rulings that might be affecting how people access their health insurance.
Sure. So back in June, the Department of Health and Human Services put out a rule that was, they called it the Marketplace Integrity Rule. And the idea, what they were saying that they wanted to do was basically tighten down eligibility restrictions as far as like getting through the enrollment process, submitting all your paperwork, doing all that to get enrolled in Marketplace coverage, because they said they wanted to combat fraud and make sure that people weren't signing up when they weren't supposed to sign up. The result of that, what HHS said themselves, was that it would be about almost up to 1.8 million fewer people enrolled in Marketplace coverage. Because basically they were just adding more hoops for people to jump through to get signed up and to get their subsidies. Some aspects of the rule was takes effect on August 25th. So we're taping this on August 25th. So this is effective now. Some aspects of this were challenged in court, and just last week on August 22nd, a judge issued a stay for some of the provisions of that rule. So some provisions are still taking effect on August 25th. For example, DACA recipients are no longer eligible for Marketplace coverage and are being disenrolled from the Marketplace. If they already were signed up for 2025, they're losing their coverage either now or within the next few weeks, depending on the state. And also, there is no longer a year-round special enrollment period for low-income people. What this was stemming from a couple of years ago, HHS had made it so that if you were low income, you could sign up for Marketplace coverage anytime without needing a specific qualifying life event. And that rule that went into effect on August 25th takes that option away. So you do need a specific qualifying life event, such as losing other coverage, in order to sign up for Marketplace coverage outside of open enrollment. So if you're low income or any income and you need Marketplace coverage, it's always in your best interest to try to go ahead and create your Marketplace account, see if you're eligible. You might have a qualifying life event that you didn't realize you did, and you can sign up. Otherwise, you'll have to wait until November 1st when open enrollment begins for 2026 coverage. And you can sign up then. All plans are open to everyone starting November 1st. You'll need to sign up by December 15th to have your coverage on January 1. But there were several provisions of that Marketplace rule that a judge has stayed, which means they just aren't going into effect. The lawsuit itself is still working its way through the court, so we don't know yet what the eventual outcome will be. But there were some provisions that were just going to make people provide, for example, more documentation of income, documentation for special enrollment period eligibility, some rules to make it so that make it harder for people to auto renew their coverage, that sort of thing. Some of that has been stayed. So there's still a lot up in the air, but just know that a court has blocked for the time being some of those rules that were going to make it more hoops for people to jump through to get their Marketplace coverage.
Thank you, Louise. And we'll be keeping people updated as it gets closer to open enrollment, as there is more changes. Then we have a question from Phyllis that she was hooked up with some useless, in her words, Medicare Advantage programs and wants to get out. So, Diane, what do you do if you are enrolled in a Medicare Advantage plan and it's not working for you?
Important question. I'm so sorry, Phyllis, about your situation. I think what happens often with Medicare Advantage is it works quite well until you need costly and complex care. And then too often you are not able to get coverage from the doctors that you want to use or the hospitals you want to use, and you find yourself unable to get the care you need. So what everybody needs to know is that you have another option, which is traditional Medicare. And that is almost always a default option, meaning that when you first sign up for Medicare, you will be automatically enrolled in traditional Medicare in most cases. And what traditional Medicare does is it covers your care from almost all doctors and hospitals all across the country. In addition, it doesn't make you go through the hoops that you often need to go through in Medicare Advantage to get the care you need. For the most part, you don't have prior authorization requirements. If your doctor thinks you need care and you want that care, it's medically necessary, you get it, and Medicare pays for it. So that's the advantage of traditional Medicare. In Medicare Advantage, you sometimes find yourself in situations where you can't get to the expert you need to see, as Phyllis, you probably have encountered, and or the insurer offering the Medicare Advantage plan blocks your coverage, denies it potentially inappropriately. So if that is the case and you want to get out of your Medicare Advantage plan, you can simply let your Medicare Advantage plan know that you want to get out, and you will be automatically enrolled in traditional Medicare. Alternatively, you can sign up for a different Medicare Advantage plan, and you will begin enrollment in that plan. Depending upon what time of year, sometimes you can disenroll and sometimes you can't. But the simplest thing to know is that you automatically will get out of your Medicare Advantage plan as soon as legally possible if you simply let them know that you no longer want to be in it, and or you sign up for another Medicare Advantage plan. And your default is always going to be traditional Medicare.
Thanks, Diane. And our next question is from Barbara, who is 62 years old, on the Affordable Care Act, and the getting rid of the tax breaks for middle-class families may make Barbara have to go without insurance for 3 years until she can qualify for Medicare. She gets ablation and back shots so she can walk. Without my back care, she won't be able to work and she would lose her home. So, Louise, let's talk about what's going on with the advanced premium tax credits for middle-class families and the Affordable Care Act.
Yes, so this is definitely a worry that a lot of people have, but I do just want to clarify that because I've sometimes seen this reported that the tax credits are going away. And just to clarify, that is not the case. If Congress doesn't act to extend these enhancements, the tax credits will revert to the way they were before 2021. So there will still be advanced premium tax credits in the marketplace, and most enrollees will still qualify for them. Before 2021, it was about 85% of enrollees qualified for tax credits. Those will continue to be available. What we've had since 2021 is an enhancement to those tax credits, which basically made them bigger and available to more people. When we talk about the bigger part of that equation, what that means is the way they make this work is under the current rules that have been in place since 2021, everyone has to pay somewhere between 0% of their income and 8.5% of their income, depending on what their income is. It's a sliding scale. So if your income is higher, you're going to be closer to that 8.5%. Or if your income is lower, you might pay nothing for your coverage. And that's to buy the benchmark plan, which is the second lowest cost silver plan. But there are lots of plans available. You can apply your subsidy to any plan. So it's not that the plan you pick will be that percent of your income. That's how they determine the size of your subsidy. If the subsidy enhancements, if Congress acts to extend the subsidy enhancements, that will still be the rule next year. If they don't, it's going to be that range, instead of being 0 to 8.5% of your income, it's going to be 2.1% to 9.96% of your income. So everything will shift up a little bit in terms of the percentage of your income.
Looks like we're losing Louise for a minute, but to finish off what she's saying, the advanced premium tax credits are changing for people, but not going away entirely for most people. So pay attention to what you get in the mail, and when it is time for open enrollment, be sure to go to the exchange and check out all of the options to figure out what's going to work best for you and your situation. So we will keep talking about that in future episodes, but this is a really important issue because Congress still has an opportunity to fix this. These advanced premium tax credits, they expire at the end of this year, 2025, but Congress could act to extend them. Some issues with the insurance exchanges and plans for next year have already been baked in when the insurers submitted their rates to various state entities a few months ago, even until relatively recently. So in many states, insurers have released two versions of their rates. One for if the premiums the tax credits get extended, and one if they don't. And the scenario where they don't get extended is where it's going to be a lot more expensive for people. So you will be getting a letter from your insurers in the next few weeks or so if you have an Affordable Care Act plan that will talk about rates for next year. But you definitely should log in, see all of your options, brace yourself, because nearly everybody is going to see some kind of increase, some people really huge increases in what they're going to have to pay. And this is still a problem that Congress could attempt to make better, although some of the sabotage by this administration is not something that is on Congress's agenda to fix. But this particular issue, the tax credits, is something that Congress could do in September when they get back. They just have not chosen yet to take action. So this is an excellent time to talk to your senators and your representative if you have insurance through the Affordable Care Act and you are concerned about costs next year, because they still have time to do something about it. And with that, please let us know your questions, your concerns. Thank you for joining us to learn how to truly make America more healthy and more insured. Please text or call in your health insurance and healthcare questions at 202-838-6837, and we'll answer them in future episodes. We're off for Labor Day week, so join us in 2 weeks for more on healthcare in America. Be sure to subscribe to my channel or podcast wherever you get your podcasts. And thanks for listening. My name is Laura Packard, and this is Care Talk.